Question 1. A 3-month-old infant presents with poor feeding, lethargy, and a heart murmur. The infant's oxygen saturation is 88%, and they are not responding to supplemental oxygen. What is the priority intervention? A. Administer prostaglandin to maintain ductal patency. B. Start resuscitation with epinephrine and intubation. C. Perform an echocardiogram to confirm the defect. D. Transfer to a pediatric cardiology unit for immediate intervention. Answer. A. Administer prostaglandin to maintain ductal patency. Rationale. Poor feeding, lethargy, heart murmur, and hypoxia are signs of a congenital heart defect, such as a ductal-dependent lesion. Prostaglandin is administered to maintain ductal patency in conditions like transposition of the great arteries until surgical intervention is possible. Question 2. A 10-year-old child presents with a fever, a red rash on the face, and a lacy rash on the trunk. The child is also experiencing joint pain. What is the most likely diagnosis and priority intervention? A. Scarlet fever. Initiate penicillin therapy. B. Fifth disease. Provide supportive care and hydration. C. Measles. Isolate and administer vitamin A. D. Rubella. Administer MMR vaccine. Answer. B. Fifth disease. Provide supportive care and hydration. Rationale. Fifth disease, caused by parvovirus B19, typically presents with a slapped cheek, rash, and a lacy rash on the body, along with joint pain. Treatment is supportive, including hydration and pain management. Scarlet fever requires antibiotics, while rubella and measles present with different rash patterns. Question 3. A 2-year-old child with asthma is admitted to the ER with respiratory distress, audible wheezing, and tachypnea. After administering albuterol, the child shows minimal improvement. What is the next best intervention? A. Administer systemic corticosteroids to reduce inflammation. B. Administer a second dose of albuterol and evaluate response. C. Start IV magnesium sulfate to relax the bronchioles. D. Intubate and prepare for mechanical ventilation. Answer. A. Administer systemic corticosteroids to reduce inflammation. Rationale. If albuterol provides insufficient relief, systemic corticosteroids are necessary to reduce airway inflammation in moderate to severe asthma exacerbations. Magnesium sulfate may be used in refractory cases, but corticosteroids are the priority for inflammation control. Question 4. A child with sickle cell anemia presents with severe bone pain, swelling, and tenderness. The child is febrile and has a white blood cell count of 16,000 per cubic millimeter. What is the most likely complication? A. Osteomyelitis. B. Avascular necrosis of the bone. C. Sickle cell pain crisis with bone infarction. D. Sepsis secondary to bone infection. Answer. A. Osteomyelitis. Rationale. In children with sickle cell anemia, the risk of osteomyelitis is high due to impaired splenic function and blood flow to the bones. Fever and elevated WBC suggest an infection, making osteomyelitis the most likely complication. A pain crisis would not typically present with fever and a high WBC. Question 5. A 6-year-old with newly diagnosed type 1 diabetes is admitted with a blood glucose level of 450 milligrams per deciliter and positive ketones in the urine. What is the priority intervention? A. Administer a bolus of normal saline and start IV insulin. B. Begin an insulin drip and administer potassium supplements. C. Initiate oral hydration and monitor for signs of hypoglycemia. D. Administer glucagon to reverse the hyperglycemia. Answer. A. Administer a bolus of normal saline and start IV insulin. Rationale. The child is presenting with diabetic ketoacidosis, DKA, which requires immediate hydration with normal saline and insulin therapy to correct hyperglycemia and ketones. Potassium monitoring and replacement will be needed as treatment progresses, but fluid resuscitation and insulin are the immediate priorities. Question 6. A 4-year-old child with a history of chemotherapy presents with fever and a neutrophil count of 100/mm superscript 3. The child is also hypotensive and tachycardic. What is the priority intervention? A. Administer broad-spectrum antibiotics and IV fluids. B. Place the child in protective isolation and monitor vital signs. C. Administer a platelet transfusion to prevent bleeding. D. Initiate antifungal therapy to treat possible systemic infection. Answer: A. Administer broad-spectrum antibiotics and IV fluids. Rationale: a fever in a neutropenic child is a medical emergency due to the high risk of infection. Broad-spectrum antibiotics should be started immediately, along with IV fluids to stabilize blood pressure. Protective isolation is important, but secondary to initiating antibiotic therapy. Question 7. A 12-month-old infant is diagnosed with congenital hypothyroidism. What is the priority intervention in the first 24 hours of diagnosis? A. Administer thyroid hormone replacement therapy immediately. B. Monitor for signs of developmental delay. C. Educate the parents about the importance of early diagnosis. D. Schedule a follow-up appointment in 1 month for reassessment. Answer: A. Administer thyroid hormone replacement therapy immediately. Rationale: immediate thyroid hormone replacement is critical to prevent developmental delays and other complications from congenital hypothyroidism. Delaying treatment could result in irreversible damage. Parent education and follow-up are important, but secondary. Question 8. A 5-year-old child presents with muscle weakness, difficulty walking, and a positive Gower sign. What is the most likely diagnosis? A. Duchenne muscular dystrophy. B. Cerebral palsy. C. Myasthenia gravis. D. Guillain-Barré syndrome. Answer: A. Duchenne muscular dystrophy. Rationale: Duchenne muscular dystrophy is characterized by progressive muscle weakness, particularly in the lower limbs, and a positive Gower sign. Cerebral palsy and Guillain-Barré syndrome present with different symptoms, and myasthenia gravis is uncommon in young children. Question 9. A 9-month-old infant is hospitalized with dehydration caused by severe diarrhea. The infant's skin is dry, mucous membranes are sunken, and there is poor skin turgor. What is the first step in management? A. Start an IV infusion of normal saline. B. Begin oral rehydration with electrolyte solutions. C. Administer antidiarrheal medication. D. Perform a complete blood count to assess for infection. Answer: A. Start an IV infusion of normal saline. Rationale: in a severely dehydrated infant with poor skin turgor and sunken mucous membranes, IV fluids, normal saline, are the first step for rehydration. Oral rehydration may be appropriate in less severe cases. Question 10. A 16-year-old male presents with sudden onset abdominal pain, fever, and right lower quadrant tenderness. What is the next best step in management? A. Administer antibiotics and monitor for improvement. B. Perform an ultrasound to assess for appendicitis. C. Start pain management and prepare for surgery. D. Perform a urinalysis to rule out a urinary tract infection. Answer: B. Perform an ultrasound to assess for appendicitis. Rationale: the clinical presentation of right lower quadrant pain, fever, and tenderness is most concerning for appendicitis. An ultrasound is needed to confirm the diagnosis before initiating treatment. Surgery may be necessary, but should be based on imaging results. Question 11. A child with a history of cerebral palsy is admitted for a routine checkup. The child is nonverbal and has poor muscle control. What is the priority nursing intervention? A. Provide a communication board to facilitate interaction. B. Administer anti-seizure medications as prescribed. C. Encourage the child to walk with assistive devices. D. Perform a complete neurological assessment. Answer: A. Provide a communication board to facilitate interaction. Rationale: nonverbal children with cerebral palsy may benefit from alternative communication methods, such as a communication board, to express their needs. The other interventions are important but not immediately necessary during a routine checkup. Question 12. A 3-year-old child is brought to the emergency department with respiratory distress, a barking cough, and stridor. What is the most likely diagnosis and priority intervention? A. Bronchiolitis. Administer nebulized albuterol. B. Croup. Administer a nebulized corticosteroid and racemic epinephrine. C. Asthma. Administer oral corticosteroids. D. Epiglottitis. Prepare for intubation. Answer: B. Croup. Administer a nebulized corticosteroid and racemic epinephrine. Rationale: Croup typically presents with a barking cough and stridor. The treatment for croup includes corticosteroids and nebulized epinephrine to reduce airway inflammation and improve breathing. Question 13. A child with a history of hydrocephalus and a ventriculoperitoneal VP shunt presents with irritability, vomiting, and altered mental status. What is the priority intervention? A. Administer acetaminophen to relieve discomfort. B. Perform a neurological assessment and check for shunt malfunctions. C. Initiate IV fluids to manage dehydration. D. Prepare the child for an MRI to assess brain function. Answer: B. Perform a neurological assessment and check for shunt malfunctions. Rationale: Symptoms such as irritability, vomiting, and altered mental status may indicate a VP shunt malfunction, which requires immediate assessment. Shunt malfunctions can lead to increased intracranial pressure and neurological damage. Question 14. A 12-year-old child with a history of asthma presents with severe wheezing and hypoxia despite bronchodilator therapy. What is the next best step in management? A. Administer oral corticosteroids to reduce inflammation. B. Administer oxygen therapy and consider intubation. C. Increase the dose of the bronchodilator. D. Initiate systemic antibiotics for a suspected infection. Answer: B. Administer oxygen therapy and consider intubation. Rationale: Severe wheezing and hypoxia in an asthma exacerbation that is unresponsive to bronchodilators indicate a need for oxygen therapy and possibly mechanical ventilation. Corticosteroids and antibiotics may be required later. Question 15. A 10-year-old child with a history of frequent UTIs presents with fever, dysuria, and flank pain. What is the priority intervention? A. Start a broad-spectrum antibiotic and obtain a urine culture. B. Administer antipyretics for fever control. C. Educate the family on proper hygiene techniques. D. Obtain a renal ultrasound to assess for complications. Answer: A. Start a broad-spectrum antibiotic and obtain a urine culture. Rationale: The child's symptoms suggest a urinary tract infection with possible renal involvement. Broad-spectrum antibiotics should be administered immediately, and a urine culture should be obtained to identify the pathogen. Question 16. A 4-year-old child with cystic fibrosis is admitted for a pulmonary exacerbation. What is the priority nursing intervention? A. Administer antibiotics and provide chest physiotherapy. B. Initiate oxygen therapy and monitor ABGs. C. Start oral pancreatic enzymes and hydrate the patient. D. Perform a complete respiratory assessment every 2 hours. Answer: A. Administer antibiotics and provide chest physiotherapy. Rationale: Pulmonary exacerbations in cystic fibrosis require antibiotics to treat infection and chest physiotherapy to clear thick mucus. Oxygen therapy and hydration may be needed later, but the priority is airway clearance and infection control. Question 17. A 7-year-old child with suspected meningitis presents with a positive Brudzinski sign, fever, and photophobia. What is the next best step in management? A. Administer broad-spectrum antibiotics after obtaining a lumbar puncture. B. Initiate IV fluids to manage dehydration. C. Begin antipyretics to reduce fever. D. Perform a CT scan of the head before lumbar puncture. Answer: A. Administer broad-spectrum antibiotics after obtaining a lumbar puncture. Rationale: Meningitis is a medical emergency. Broad-spectrum antibiotics should be started immediately after a lumbar puncture to confirm the diagnosis and determine the pathogen. CT scan is not indicated unless there are signs of increased ICP. Question 18. A 3-year-old child with a history of seizures is brought to the emergency department after a febrile seizure. The child is now alert and stable. What is the priority intervention at this time? A. Administer an anticonvulsant to prevent further seizures. B. Ensure the child is hydrated and monitor temperature. C. Educate the parents on the risk of febrile seizures. D. Perform an EEG to assess for underlying epilepsy. Answer: B. Ensure the child is hydrated and monitor temperature. Rationale: after a febrile seizure, the priority is to manage the underlying fever and ensure hydration. Anticonvulsants are not necessary if the child is stable, and further diagnostic testing may not be required unless seizures continue. Question 19. A 16-year-old female with a history of anorexia nervosa presents with electrolyte imbalances and severe weight loss. What is the first priority in her care? A. Initiate refeeding with a high-calorie diet. B. Correct electrolyte imbalances and rehydrate. C. Provide counseling and therapy to address the underlying issue. D. Monitor for signs of cardiac arrhythmias and initiate antiarrhythmic medications. Answer: B. Correct electrolyte imbalances and rehydrate. Rationale: the priority is to stabilize the patient by correcting electrolyte imbalances and rehydrating, as these issues pose immediate life-threatening risks. Nutritional support and counseling are important, but should follow stabilization. Question 20. A 10-year-old child with a history of cerebral palsy and feeding difficulties is being discharged with a gastrostomy tube. What is the most important teaching point for the family? A. Ensure the child receives adequate hydration and nutrition through the tube. B. Avoid any oral intake to prevent aspiration. C. Check for proper tube placement before each feeding. D. Administer medications directly through the tube for easier absorption. Answer: C. Check for proper tube placement before each feeding. Rationale: ensuring proper tube placement before feeding is essential to prevent aspiration and potential complications. While hydration and nutrition are critical, the first step is verifying tube placement to ensure safety. Question 21. A 5-year-old child with a history of febrile seizures presents with a fever of 40 degrees Celsius, 104 degrees Fahrenheit, and tonic-clonic movements. What is the priority intervention to prevent further complications? A. Administer antipyretics and monitor for seizure activity. B. Perform a lumbar puncture to rule out meningitis. C. Administer intravenous diazepam for seizure control. D. Place the child in a cooled environment and provide fluids. Answer: C. Administer intravenous diazepam for seizure control. Rationale: febrile seizures are common in young children, but if the seizure lasts for more than 5 minutes, intravenous diazepam is the priority to stop the seizure. Antipyretics and cooling are important, but do not address the seizure's immediate risk. Question 22. A 9-month-old infant presents with jaundice, irritability, and poor feeding. Liver function tests are elevated, and the infant's growth has slowed significantly. What is the priority intervention to prevent liver failure? A. Start corticosteroid therapy to reduce inflammation. B. Initiate phototherapy to reduce bilirubin levels. C. Prepare the infant for urgent liver transplantation. D. Perform a biliary atresia surgery to correct the defect. Answer: D. Perform a biliary atresia surgery to correct the defect. Rationale: biliary atresia requires prompt surgical intervention to correct the blockage and prevent liver failure. Corticosteroids and phototherapy do not address the underlying anatomical issue. Liver transplantation is a last resort and is not immediately necessary. Question 23. A 3-year-old child presents with dehydration from severe vomiting and diarrhea. The child's blood pressure is 90/60 millimeters of mercury, heart rate is 150 BPM, and respiratory rate is 40 breaths per minute. What is the first priority intervention? A. Administer oral rehydration solutions, ORS, to replenish fluids. B. Start IV normal saline bolus to restore circulation. C. Administer antiemetics to reduce vomiting. D. Place the child in a semi-Fowler's position to ease breathing. Answer. B. Start IV normal saline bolus to restore circulation. Rationale. Given the child signs of dehydration and hypotension, the first priority is to start IV fluids to restore circulating volume. ORS can be considered later if the child's condition stabilizes, but IV fluids are necessary to address the acute situation. Question 24. A 6-year-old child with a known diagnosis of asthma presents with severe wheezing, chest tightness, and a peak flow of 45% of their personal best. After administering albuterol, the child shows no improvement. What is the next intervention? A. Administer oral corticosteroids to reduce airway inflammation. B. Administer a nebulized corticosteroid. C. Start continuous albuterol nebulization and prepare for intubation. D. Administer epinephrine intramuscularly to reverse bronchoconstriction. Answer. C. Start continuous albuterol nebulization and prepare for intubation. Rationale. In a severe asthma exacerbation with no improvement after albuterol, continuous nebulization of bronchodilators is needed. If this does not improve the condition, intubation may be necessary to secure the airway. Corticosteroids and epinephrine are important, but are secondary in this setting. Question 25. A 7-year-old child presents with intense abdominal pain, fever, and right lower quadrant tenderness. The child has a WBC count of 16,000 per cubic millimeter. What is the next step in management after stabilizing the child? A. Administer broad-spectrum antibiotics and prepare for surgery. B. Perform a laparotomy to examine the appendix. C. Perform an ultrasound to confirm appendicitis. D. Administer IV fluids to restore hydration and wait for further symptoms. Answer. C. Perform an ultrasound to confirm appendicitis. Rationale. Ultrasound is the most appropriate diagnostic tool to confirm appendicitis in a child with clinical signs and elevated WBC. Immediate surgery is not indicated without imaging confirmation, and antibiotics may be started later depending on the findings. Question 26. A 2-year-old child with a history of eczema presents with acute flaring of the skin, accompanied by fever and enlarged lymph nodes. What is the priority intervention to prevent systemic complications? A. Administer oral antibiotics for suspected bacterial superinfection. B. Initiate topical corticosteroids for skin inflammation. C. Perform a viral culture to determine the cause of the flare. D. Provide oral antihistamines to reduce itching and discomfort. Answer. A. Administer oral antibiotics for suspected bacterial superinfection. Rationale. Children with eczema are at risk for bacterial superinfection, particularly with Staphylococcus aureus. Oral antibiotics are necessary to treat the infection and prevent systemic complications. Topical corticosteroids may be used later, but antibiotics are the immediate priority. Question 27. A child with cerebral palsy is admitted for a routine checkup. The child has severe spasticity and difficulty swallowing. What is the most critical aspect of the nursing care plan? A. Administer botulinum toxin to reduce spasticity. B. Ensure the child receives adequate nutrition through enteral feeding. C. Start physical therapy to improve motor function. D. Educate the family on signs of aspiration pneumonia and provide feeding precautions. Answer. D. Educate the family on signs of aspiration pneumonia and provide feeding precautions. Rationale. Children with cerebral palsy often have difficulty swallowing and are at high risk for aspiration pneumonia. Educating the family on feeding precautions is the priority. Botulinum toxin and physical therapy may be part of the plan, but preventing aspiration is paramount. Question 28. A 6-month-old infant is admitted with signs of dehydration, poor feeding, and lethargy. The child's serum sodium is 155 mmol per liter. What is the priority nursing intervention? A. Administer IV fluids with a low sodium concentration. B. Administer IV fluids with isotonic saline and monitor sodium levels. C. Provide oral rehydration solutions, ORS, to restore hydration. D. Initiate IV fluids with high sodium concentration to correct hyponatremia. Answer. A. Administer IV fluids with a low sodium concentration. Rationale. Hypernatremia due to dehydration requires slow correction with IV fluids that have a lower sodium concentration to avoid cerebral edema. Rapid correction with isotonic fluids could worsen the condition. Question 29. A 10-year-old child presents with sudden onset of right lower quadrant pain, fever, and vomiting. A CT scan reveals an appendiceal perforation. What is the priority intervention in this case? A. Administer IV antibiotics and prepare for emergency surgery. B. Administer oral antibiotics and monitor for complications. C. Provide pain management and fluid resuscitation. D. Place the child on nothing by mouth NPO status and prepare for a CT-guided drainage procedure. Answer. A. Administer IV antibiotics and prepare for emergency surgery. Rationale. A perforated appendix requires prompt surgical intervention along with IV antibiotics to prevent peritonitis and sepsis. Oral antibiotics are not sufficient, and pain management should not delay the immediate need for surgery and infection control. Question 30. A 4-year-old child with a known history of asthma presents with an acute exacerbation and shows signs of respiratory fatigue. What is the priority intervention at this stage? A. Administer systemic corticosteroids to reduce airway inflammation. B. Prepare for intubation and mechanical ventilation. C. Administer continuous nebulized albuterol for bronchodilation. D. Start IV fluids to hydrate and improve circulation. Answer. B. Prepare for intubation and mechanical ventilation. Rationale. Respiratory fatigue is a sign that the child is failing to maintain oxygenation and ventilation. Intubation and mechanical ventilation are required to secure the airway and support breathing. While bronchodilators and corticosteroids are essential, they are secondary in the face of respiratory failure. Question 31. A 6-month-old infant is diagnosed with neonatal sepsis and presents with tachycardia, respiratory distress, and temperature instability. What is the priority nursing intervention? A. Administer broad-spectrum antibiotics immediately after obtaining blood cultures. B. Start IV fluids to maintain blood pressure and hydration. C. Administer acetaminophen to control fever. D. Provide oxygen therapy and monitor oxygen saturation. Answer. A. Administer broad-spectrum antibiotics immediately after obtaining blood cultures. Rationale. Neonatal sepsis is a medical emergency, and prompt initiation of broad-spectrum antibiotics is crucial to prevent systemic infection. Blood cultures should be obtained prior to administering antibiotics, but they should not delay treatment. Question 32. A 7-year-old child with a history of sickle cell anemia presents with chest pain, fever, and respiratory distress. What is the most likely diagnosis and priority intervention? A. Acute chest syndrome. Administer oxygen and initiate IV antibiotics. B. Acute stroke. Administer pain relief and initiate blood transfusion. C. Pulmonary embolism. Administer anticoagulation therapy. D. Pneumonia. Administer broad-spectrum antibiotics and fluids. Answer. A. Acute chest syndrome. Administer oxygen and initiate IV antibiotics. Rationale. Acute chest syndrome is a common complication of sickle cell anemia, presenting with chest pain, fever, and respiratory distress. It requires prompt administration of oxygen and antibiotics. Blood transfusion may be necessary later. Question 33. A 3-month-old infant with a suspected bacterial infection is receiving antibiotics. The child develops a skin rash, fever, and difficulty breathing. What is the priority action? A. Discontinue the antibiotics and administer epinephrine. B. Administer antihistamines to reduce the rash. C. Start IV fluids to improve hydration. D. Perform a blood culture and prepare for isolation. Answer. A. discontinue the antibiotics and administer epinephrine. Rationale: the infant's symptoms suggest an allergic reaction to the antibiotics, possibly anaphylaxis. The priority is to discontinue the drug and administer epinephrine to counteract the reaction. Question 34. A child with a history of developmental delay is brought to the clinic with signs of a respiratory infection. What is the priority nursing intervention in this situation? A. Obtain a thorough developmental history and assess for any new delays. B. Administer the prescribed antibiotics for the respiratory infection. C. Provide family education about infection prevention. D. Assess the child's respiratory status and oxygenation. Answer: D. Assess the child's respiratory status and oxygenation. Rationale: the immediate priority is to assess the child's respiratory status to ensure adequate oxygenation and prevent further complications. While the infection and family education are important, respiratory management is the most critical. Question 35. A 4-year-old child with chronic asthma presents with a respiratory rate of 36 breaths per minute and a pulse oximetry reading of 92%. What is the priority intervention? A. Administer nebulized albuterol and recheck oxygen saturation. B. Administer oral corticosteroids to reduce airway inflammation. C. Provide high-flow oxygen and monitor respiratory status. D. Perform a chest X-ray to evaluate for pneumonia. Answer: A. Administer nebulized albuterol and recheck oxygen saturation. Rationale: the child's symptoms suggest an asthma exacerbation. Nebulized albuterol is the first-line treatment to relieve bronchospasm, and rechecking oxygen saturation will guide further intervention. Oxygen therapy may be necessary later if the saturation decreases. Question 36. A 2-year-old child is diagnosed with Kawasaki disease. What is the priority nursing intervention to prevent long-term complications? A. Administer IV immunoglobulin IVIG to reduce inflammation. B. Start high-dose aspirin therapy to reduce fever. C. Perform an echocardiogram to assess for cardiac involvement. D. Administer corticosteroids to reduce inflammation. Answer: A. Administer IV immunoglobulin IVIG to reduce inflammation. Rationale: IVIG is the treatment of choice for Kawasaki disease, as it reduces the risk of coronary artery aneurysms. High-dose aspirin may be used later, but IVIG is the first-line intervention. Question 37. A 9-year-old child is admitted with severe abdominal pain, vomiting, and a distended abdomen. A physical exam reveals tenderness in the right lower quadrant. What is the priority action? A. Perform a diagnostic laparoscopy. B. Start IV antibiotics and prepare for possible appendectomy. C. Administer pain medication and observe for changes. D. Obtain a CT scan to confirm appendicitis. Answer: B. Start IV antibiotics and prepare for possible appendectomy. Rationale: the child's symptoms are highly suggestive of appendicitis, and IV antibiotics are administered to prevent infection. Surgery may be necessary, but antibiotics are started immediately. Question 38. A 16-year-old female with anorexia nervosa presents with electrolyte imbalances and bradycardia. What is the most important intervention? A. Administer potassium supplements to correct the imbalance. B. Provide refeeding with a high-calorie diet. C. Correct the electrolyte imbalances with IV fluids and monitor cardiac status. D. Start antidepressants to address the underlying psychiatric issue. Answer: C. Correct the electrolyte imbalances with IV fluids and monitor cardiac status. Rationale: correcting electrolyte imbalances is the priority to prevent life-threatening complications, such as cardiac arrhythmias. Refeeding can cause refeeding syndrome, so electrolyte correction must be done gradually. Question 39. A 3-month-old infant with hydrocephalus is found to have a VP shunt malfunction. What is the priority intervention? A. Administer diuretics to reduce cerebral edema. B. Prepare for surgical revision of the VP shunt. C. Perform a neurological assessment and check for signs of increased intracranial pressure, ICP. D. Start antibiotics to prevent infection of the shunt. Answer: C. Perform a neurological assessment and check for signs of increased ICP. Rationale: the first priority is to assess for signs of increased ICP, which could lead to brain herniation. Surgical revision of the shunt may be necessary, but the assessment must come first. Question 40. A 10-year-old child with a history of cerebral palsy presents with increased muscle rigidity, difficulty swallowing, and a fever of 39 degrees Celsius, 102.2 degrees Fahrenheit. What is the most likely diagnosis and the priority intervention? A. Spasticity due to cerebral palsy, increased dosage of muscle relaxants. B. Upper respiratory infection, administer antibiotics. C. Central nervous system infection, e.g. meningitis, perform a lumbar puncture. D. Malignant hyperthermia, administer dantrolene and cooling measures. Answer: D. Malignant hyperthermia, administer dantrolene and cooling measures. Rationale: malignant hyperthermia is a rare but life-threatening condition that can occur in children with cerebral palsy after exposure to certain triggers like general anesthesia or severe muscle rigidity and hyperthermia. Immediate intervention with dantrolene, a muscle relaxant, and cooling measures is essential to prevent complications. Cerebral palsy, upper respiratory infections, and CNS infections may present with symptoms that overlap, but the combination of muscle rigidity, fever, and difficulty swallowing suggests a more critical condition like malignant hyperthermia. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying!